All right, let's do a little education on postpartum hemorrhages so that if you happen to go through one, it can be a very scary experience, but if you know what's happening and why, that takes a lot of the fear away. First of all, they're pretty uncommon. They only happen to about 3 to 5% of births. The ACOG definition of a postpartum hemorrhage is losing 1,000 or more milliliters of blood after birth. Now, one of the first things you're going to notice is a ton of people coming in your room if you're having one. Usually someone reports feeling a lot of trickling of blood. Their uterus is not contracting. It's very what we call boggy. So you're going to have somebody coming in your room furiously massaging your fundus, trying to get it to firm up so that bleeding kind of stops. Someone might be trying to get an IV in you if you don't already have one. And this is just so we could potentially administer medications like pitocin that can help you contract and stop that bleeding. Someone might also be trying to put a Foley catheter in you because if your bladder is full of urine, that can keep your uterus from contracting effectively. So draining all the urine out of your bladder is going to help that. Other than the pitocin, there are other medications we can give. One is an injection of methergine. There's another medication we can give in your rectum actually to help. So we might do those. Usually the doctor will be at your bedside telling us what medications they want us to give. Someone will also be drawing your labs to see what your platelets and hemoglobin and hematocrit are. And typically you're also offered pain medicine because of all of that fundal rubbing.